Some signs in the breast that you should never ignore. Whenever you see those signs in the breast, you should never ignore them. You're very much welcome to today's video. This is Dr. Rabo, and in this channel, we talk about health for mothers and health for babies. And if it's something you're interested in, please join the family and let's get right into it. And always remember to share our videos to help someone out there. So let's go. So today we're going to be talking about some signs in the breast that you should never ignore. Whenever you see those signs in the breast, you should never ignore them, because when it comes to the breast, it's important we know that the breast undergoes so many changes right from puberty. Every time you see your menses, by the time you become pregnant, when you get to menopause, during these phases, the breast is going to be undergoing so many changes. And when it comes to the breast, it's important to pay attention to these things. From the puberty phase, by the time you start seeing your menses, each time you see your menses every month, by the time you get pregnant, you start breastfeeding, when you are done breastfeeding, even by the time you are approaching menopause, the breast is one organ that is going to be undergoing different changes. So it's worth talking about. At what point do you say, oh, this is normal? At what point do we say this one should be checked? This is not looking okay. And when it comes to the breast, it is best these things are checked as early as possible without delay. And it's also important we know that breast sizes, breast shape, how your breast looks like, all of these things can be tied to how you were born. They can be tied to what runs in your family. It's important we know what is normal and what is abnormal. So I'm going to be mentioning a couple of these things we should never ignore when it comes to the breast. Let's talk about the size. If you look yourself in the mirror, in some women, it is very obvious one breast is bigger than the other. If this has been your norm right from childhood, then it is normal for you. But if suddenly you just discover that one breast is suddenly bigger than the other, you're not breastfeeding, you didn't suddenly become pregnant and all of that, suddenly your breast, one of the breasts just suddenly became bigger than the other, that is worth checking, and it is better you check it as early as possible. Then the shape of your breast, you since childhood, you growing up and all of that, you already know the shape of your breast. If your breast is round and all, maybe during pregnancy, after putting to bed and all of that, you may discover that it may not be as round as it used to be before, then that is normal. But all of a sudden, you just discover that your breast used to be very round, all of a sudden you're looking as if the shape is changing, no matter the shape it may be. It's important to check that as well with your doctor without delay. The third one is suddenly you're noticing that there's something like eczema on your breast. Breast eczema is not a good sign at all. Do not say, oh, it's just a normal skin rash. No, when it comes to the breast, whenever you see any form of eczema, it is worth checking, and it is best to check it early. Sometimes you may even discover that you're seeing a rash around the breast. Sometimes the rash may look as if it is red, it is looking dark in color. That is worth checking as well. So do not just say, oh, this is, it will go away. When it comes to the breast, you must take quick measures so you know that you're not putting yourself in harm's way. It's normal for some people to have inverted nipple. If while we were growing up, you've always had inverted nipple, this is usually normal in some people. So you've always known yourself as a lady or as a woman, you've always had inverted nipple. This is usually the normal type. But your nipples have never been inverted right from when you were growing up. You've always known yourself to always have normal nipples, and all of a sudden you're seeing that this nipple, one or the two of your nipples are becoming inverted. That needs to be checked immediately. Another point is the color. You know your skin color, you know your skin tone. If all of a sudden you're seeing any kind of discoloration around your breast, whether it is around the nipple or around the breast itself or around the areola is just the skin surrounding your nipple. If you're seeing any form of discoloration at all, whether it is red you're seeing there, whether you're seeing any form of color you're seeing at all, that needs to be checked with. When it comes to your breast, it is for you to be paying attention to what is going on your body per time. That's why I keep telling women, know your body, know how that area feels during your menses, know how it normally feels after your menses, know how it feels during your ovulation period, so that if anything is abnormal, you can say, oh, this is different from what I used to know. So let's talk about pain. Pain can be a pointer to something very serious, and it can also be a pointer to something not so serious. Though, for instance, if you're a breastfeeding mom, your baby is not latching properly, you've not gotten the technique of breastfeeding well, maybe you're having a crack on your nipple and all of that. And this crack can even lead to you having a breast infection. Before you know it, pus can accumulate there. These are things that you know that it is related to breastfeeding, which should actually be treated. In this other more severe case, you're not breastfeeding, you don't have a baby, you're not nursing, you did not fall, nobody hit you there, there was no trauma, nothing. You just suddenly developed pain in your breast. that should be checked as early as possible. Oftentimes, we hear a lot about lump in the breast. Yes, lump in the breast can be very common, but sometimes it can be very normal. When it comes to your menstrual phase, during your menstrual period, you may actually experience some change in texture of your breast. And that is why I generally encourage that if you want to check your breast, really, it is best you always check it after your menstrual period so that you are sure it is not related to your menses. And when it comes to the one related to your menstrual cycle, it is often on both breasts, but not that this there's a swelling on one side and all of a sudden you're just seeing the swelling suddenly on one side. That should be checked. When it comes to your breast, look at the skin as well. If you're seeing that the skin is suddenly changing, you're seeing that the skin on your breast is dimpling. And what I mean by dimpling is that you're seeing that there are some pinpoint holes, tiny holes. They're not making your breast almost looking like the back of an orange. That is one sign you should never ignore. Another point is anytime you notice a discharge on your breast, be it the nipple or any boil, that should be checked. Like I mentioned initially, when breastfeeding, these things can happen, but however, it can happen when you have a crack. This crack can lead to breast infection, and there's a pus accumulating in the breast, which needs to be treated. A more severe one is that you're not breastfeeding, all of a sudden you're seeing discharge. It can be something that looks like water, sometimes it can look like something like mixed with blood, something looking like pus. Those things should never be ignored. Do not say, oh, it's nothing serious. Let me just go and buy paracetamol and I'll be fine. That breast needs to be checked and it needs to be checked as early as possible. So when it comes to your breast, always pay attention to what is normal to you, what you've always known to be normal with you. So if along the line you're noticing that there's a change at all, suddenly you're just noticing this change, right? That should be checked as early as possible, especially when you're not menstruating, you're not breastfeeding, you're not pregnant. All of those things can actually cause breast change. So if you're not in any of these categories, and all of a sudden you're having this sudden change in your breast, that should be checked as early as possible. These are some of the points we all can pay attention to when it comes to the breast. And whenever there's a change, it's best it is checked as early as possible. So if you watched at this point and it has been helpful to you, ensure you share with your family and friends. Join the family, click the like button, and I will see you in the next one. Thank you for watching. Bye.